the name of this talk is how to communicate with your doctor about your CRPS. You know, seeing your doctor seeing your doctor or anybody for anything. I know when I go to see my doctor, even though, you know, I know him, he's my buddy, etc., you know, there is a certain feeling of uneasiness seeing somebody, especially for the first time, especially if you have CRPS, especially if nobody understands you, especially if you go through life with a lot of difficulty. So just a few things about how to manage and communicate with your doctor. You know, you need to prepare for the visit. That's really critical. Preparing for the visit makes it easier for the doctor to treat you, and also for you to be able to communicate what you have. And that's not an easy thing to do. What we want to discuss today is also what to expect during the visit, what to go over with the doctors. What you want to have is having your demographics ready, your name, insurance, social security number, everything. Give it to the front desk. Set up a good relationship with the front desk because they are the, you know, and for that, I know when you're with the doctor, you're with the doctor for a brief period of time. And a lot of times you have to deal with the front office, with the back office, etc. So giving them what they need and having a relationship with them, is really important. It takes it a long way for you. Then we're going to discuss about what to tell your doctor, how to tell your doctor about your pain, about your functional limitations, emotional limitations, etc. So all of these are critical in order to have a very successful treatment. Remember, that's the bottom line. We're all here to be able to have a situation where the CRPS is manageable and we are able to do a lot more. People in the community, unfortunately, through no fault of their own, they don't know chronic pain. Most doctors don't know chronic pain. So much so if you talk about CRPS. CRPS, forget it. Most people don't know anything about it. So before you see your doctor, what you want to do? Okay. The more you do, obviously, the better. Put all your information together. Have somebody with you. I strongly recommend a loved one, a family member, a friend. One is probably enough. Two becomes a little bit of a crowd. Have them come in, tell them about what you're going for. It's better if there's somebody that you know, that you already are familiar with, so that makes it a little bit easier for them to understand what's going on. And also you're going to have some points, you're going to make some notes for yourself, give them a copy of your notes so they can talk to the doctor about you or remind you later what you talked about. You probably won't remember a lot of the meeting, and it is okay. This is what you want doing with your doctor is building a relationship, and it takes time. Guess what? You know, the doctor won't know a lot about you at the beginning either. It takes time. So the more you talk to each other, the better. They can write note down for you, ask questions, answer questions, etc. Remember this: an educated patient is a smart patient, a patient who will get better. I know it, all of you are here, all of us are here to be more educated, to be more involved in CRPS, whether it's our own CRPS or somebody else's pain and CRPS. and it's critical to know as much as you can. Granted, though, you will get a lot of information from here and there, or from the or from the internet that's not so exact or correct. So you have to be able to find out what is the source, what are they, who's talking about, is it WebMD or Dr. Joshua Prager, or is somebody around the block that's talking about this? Big difference. So education, education, education. What you want to do, what you, especially with CRPS, remember there is no specific test for CRPS to confirm it. It's diagnosis based. So you have to kind of be able to show your doctor and everybody else what is going on. You don't have to exacerbate, exaggerate, anything like that. Most people with correct treatment, they do better after time. And you know, a lot of times when the problem with the CRPS has improved, it would be a little bit harder to diagnose it as well. So the background is important, your medical records is important, etc. All right, here is a little bit, this slide is a little bit too serious, and I apologize. So what do? You don't want to drive your doctor crazy. We all do. We want to keep the doctor focused, because if you tell him everything about you and everything that you want, you know, you're there is this pressure building up to transfer tons of information from your mind into the provider's mind, and that is very difficult to do. What you want to do is be methodical, be focused on things that are important towards the CRPS. The doctor doesn't need to know that, you know, last night at 2 a.m. you woke up with some extra pain. I mean, it may be important, but it has its own place. Don't overwhelm the doctor, but by giving them every symptom you have. You know, us people with CRPS, we have a lot of symptoms. A lot of the symptoms become exacerbated, whether it's by the CRPS or because the CRPS causes you not to be able to move correctly or think correctly or whatever. So not everything is CRPS, but some of the symptoms are CRPS. My recommendation, focus on the major problems you have, especially at the beginning. You want to tell him or her about, you know, well, it started in my left arm and the hand, and, you know, most of my problem is here, and this is what happens, and this is what it's not letting me do, this is that what it drives me crazy, drives me depressed. I yell at my significant other when it's severe, or I get under the blankets and cover my face when it's severe. Whatever it is, you know, these are the things that the doctor wants to hear. The next thing, you don't want to belittle others. You know, CRPS patients especially, you know, you probably, if I had a show of hands here, let's do that. How many of people do you know or yourself have been misdiagnosed and then you found out you had CRPS? Can I? A significant number of people, and that's really critical. So, you know, what you want to do, I think, a positive attitude, just like Roxanne mentioned, you're fighters. You know, you don't want to badmouth, because that, you never know, the last the last doctor or provider that you saw and didn't like, maybe that doctor's friend. I'm saying that in a semi-joking way, but you know, you don't want to post anything negatively. You don't want to discuss anything behind people's back, because that kind of turns the doctor off. As I said, this part is a little bit serious, and I apologize about that. And if there are people in the room, you want to include them, you want to have a positive atmosphere there, and that's really critical. And feel free, the doctor is working for you, the provider is working for you. If you don't know, if you haven't found out enough about their background, ask them. Doctor, what's your background? Have you done CRPS patients, etc.? If you're Dr. Prager, you only do CRPS. If, there are a lot of good doctors that don't know what CRPS is, so you want to see a doctor that understands it and knows what to do with it, whether they have a lot of patients or some patients. They need to be well informed. Okay, let's switch a little gear. What do you ask the first time? The first time you're there, you are sitting there, etc. Now, I'm switching back and forth a little bit. I'm assuming that we are now assuming that you had the doctor ask you some questions, you did an exam, and then etc. So if you don't know what you ask them, what is the cause of my pain? Do I have CRPS? You can always ask if you don't know. Why is it that it gets worse certain times? Some days I'm better and get up, I feel better. Some days I don't, I feel horrible, or some activity hurts me, another time it doesn't. Remember, CRPS can be caused by a trauma, can be caused by surgery, or you may not even know what caused it. So it's as you know, amazing phenomenon, very difficult. What can I do to prevent from this thing from getting worse? Really critical, because we all told what to do: exercise, move. But you know better. If you do too much exercise, move, what happens? You get a lot worse for a few days. So it's a fine line. So what do I do to make things so I don't develop more complications? Of course, exercise, move is important, but it should be done correctly. What treatment options are there? Self-management options. Thank God we are in 21st century, and our patients, their patients, are very, very smart, and they have access to so much information, and some of it is really good. So if there are any ways that the patient, you can do, whether it's different exercises, whether it's yoga, or you name it, it's wonderful. Ask. I would probably ask before doing, because sometimes a treatment that's good for somebody else, even another person with CRPS, it may not be the best thing for you. So that's another information. And what resources, support, charities, etc., that I can be involved. Of course, you guys are here, CRPS Forum, that's one of the best. And it's important to be part of a group, because you can give. And you already know this, I'm going to tell you, I promise you, the more you give, the more you discuss, the more you help others with CRPS, you get back more. Okay, so how do you tell, let's talk a little bit about the nuts and bolts of your symptoms. So where is the pain? Okay, and a lot of times, people with CRPS, I mentioned before, we have aches and pains all over. Some of it is CRPS, some of it is not, some of it is from arthritis, some of it is from fibromyalgia, some of it is extension from the CRPS. Start with the major areas and then build this up. Then you talk about what makes the patient worse, what makes patient pain better. It's important to bring a note for yourself. Make notes beforehand, and make that a habit to write yourself a little pain diary every day. I promise you, after a while, it becomes a very important part of your treatment, and you love it. What activities makes it worse? What activities make it better? How is the pain affecting my emotions, my feelings. What do I feel like when it's really bad? Or has that pain caused me to be always angry, always upset, anxious, depressed? Remember, pain in general and depression and anxiety, they go many times hand in hand, especially with CRPS, and they both need to be treated. It's not because you were emotional or depressed or angry or anxious that you have CRPS. The CRPS makes you that way. So going about what you tell your doctor, you tell them about, what treatments you've had, what medications you've had, what do you take in now, did you take before, why aren't you taking it now? The side effects, etc. What you want to do with all this is so that your doctor doesn't try to reinvent the wheel, because a lot of times you might have had something with the bad side effects, and the doctor says, that's the first line treatment, and if you don't tell him, you might get that treatment. And any procedures you've done, of course, you discuss it. Usually they give you a long, if you come to my office, a long note to write. You bring somebody to write for you if you can, because those notes are important. Tell you, take your time, dictate it to somebody, do it, because the more you write beforehand, the more the doctor knows, and it's easier for you to bring it up, and easier for the doctor to kind of focus on what to do for you. So, doctor, do I have CRPS? How do you know? If you have that kind of question still in your mind, please ask. Prognosis, we all are worried about the prognosis. What's my prognosis? Am I going to be able to live a long time? Am I going to be able to live with pain a long time? Am I going to be getting worse, etc., etc., etc.? All very important, and you feel free to ask. The answer to most of these things is obviously not very easy or simple. It all depends, but then it gets your mind and your doctor's mind running, what specific treatment protocols you have for this kind of pain that I have, this kind of CRPS I have. Is there any treatment that's not covered by my insurance? We all know cost is important, whether you live in the United States or in another country with totally socialized medicine. It doesn't matter. This is not the forum for that, but suffice it to say there are things that insurance does not cover, but you might want to talk to your doctor about it. There might be ways to get it covered, etc. And all of this is critical. Okay, excellent. So do's and not do's again. What do you ask your doctor? Hey, I feel like I'm always walking on eggshells. If I do this, it gets worse, and I do the opposite, it gets worse, etc. The goal of treatment in general is to reduce the pain and improve your ability to function. So there are many treatment options, and they usually they don't take away all of your pain. They can reduce your pain, but I guess you already realize here that no pain does not exist. Everybody has pain. A CRPS patient will always have pain, and that's okay as long as it does not destroy you, maybe even make you stronger, just like Roxanne said. In a way, I don't mean that in a negative way, but you cannot have no pain, but at the same time, you want to reduce the pain enough so that you can enjoy life better, and you can do more, be more functional as to what you want to do, etc. And make sure the support groups, especially critical. CRPS is not easy to treat, you already know that, and support groups are absolutely critical. My future as CRPS patient, where do I go from here? Do I need to stop working? Do I need to stop playing golf? I mean, the things that are important to you as the patient, that's what really counts. And is there a cure? Am I gonna get completely better? We don't know. Sometimes CRPS, goes away for a while by itself, kind of goes into remission. Sometimes it doesn't. It can bug you every day, which most people it does, as long, again, it depends on how much. It can go away for a while. Is there anything I should not be doing at all? Or is there anything when I'm doing something, how much, etc.? These are very, very important. Remember, it's not just a pain or a pill or a procedure. As you can see, a lot of the treatment depends on the patient. Okay, switching a little bit gear, in general, the best thing you want to refer to your patient is to tell them or relate to them through all your discussions. What are your expectations here? What is it that you want to achieve? And for different patients with even the same problem, expectations may be different. One may say, I want to be able to walk better, stand better, or not be so depressed all the time, or that pain not to destroy me and drive me crazy all the time. Whatever is bothering you, focus on it and allow the doctor to know. It's not going to be one or two sentences a lot of times. It's going to be by discussing it with the doctor or bringing it out, so to speak. Very important concept here I want to go over with you. Seeing the doctor is important. Going through the process is important. Remember, the doctor is there to help you and is, working for you. When the doctor, I would not be in pain practice if there weren't any pain patients. So feel free, don't abuse the doctor, but feel free to ask. You can say, no, it's impossible, or it's out of my hands, but use it, have an open relationship with them. That's the best way. Respectful, professional, open, be pleasant, don't try to overwhelm them, but keep it up. Now, we're going to switch gears a little bit, and we're going to go into the doctor's thinking. What is he thinking? Or what is she thinking? This circle is, symptoms of CRPS. That's what the doctors think about when they want to diagnose CRPS. Most of you probably have seen this, you've been through this, pain spreading, hands, different types of hair growth, the nails, blood vessel changes, blood flow changes, pain that gets unexpectedly worse after a trauma, or maybe there was no trauma, etc. These are the things that the doctors think about. So that's what the doctor is going through. So now your physical exam is done, and you're kind of, you want to get a little bit more information. So first question, again, that's the main question of CRPS. The answer is I don't know. Nobody knows. If the injured part has healed, why is the arm or the leg still hurting? Ask if you don't know. There are answers. One of the major things with chronic pain, especially CRPS, and I promise you, I went through it in medical school. medical school, you know, I was a good student, but I had CRPS. One of the doctors wrote in my chart that he has functional pain. Back then, that really upset me, but not anymore. So people don't understand it, and it is one of the things that you need to be able to do with your doctor is to validate your diagnosis. If your doctor does not validate you or your problems or your feelings, don't see them. I didn't say validate your CRPS because some of us, the doctor may not be at that time diagnosed as CRPS. Maybe it's in remission. Maybe there are other ways. But the fact that you are suffering with all these problems, that's critical. That's very, very important to be able to discuss with your doctor, and for your doctor to give you some solid answers. Some of the answers maybe we just don't know. But what you're feeling, what you have is real. It's not in your head. You know, you're not so-called abnormal in your thinking or behavior or feelings, etc. If you got it, if you feel it, it's there. Okay, so I'm a little bit more when you know, say doctor is giving you a bunch of procedures, a bunch of stuff to do. So what do you ask? So why am I taking the medication? What should I take? What should I expect from it? What are the side effects? Do you treat CRPS patients? How do you treat them? Sometimes you can ask, can I talk to some of them? That's okay to do. You may say no, or she may say no. She may say yes. There may be some patients that are willing to talk, some they may not be. What happens if the procedure does not work? What happens if the medication does not work? What's the next course of action? These are part of the informed consent. Some of it, remember though, that the doctor might have a nurse or a person who works in the office explain further to you. So you have the question, your question is valid. It may not be answered that same day or same time, but keep it in mind. The doctor might even forget to answer it. Bring it up and say, hey, you know, next time you can bring it up. Hey, you know, I want to know what's going on. What's next for me? Don't feel bad about asking questions. If you don't get all the answers at the same time, which you won't probably, because you probably have a very limited, short time, right? How many of you think that your doctors always spend enough time with you? That's impressive. I thought it would be less, but we had a handful here. It's difficult because the doctor is going through a lot, trying to, you know, see what's going on and take care of the patient, give great service, and go to the next patient. And the patient has this huge bottle of stuff that he has to give to the doctor to drink, to get into his mind, you know, communicate into his or her mind. So not all of it gets through. And doctors are human. As long as you have a relationship with them, it's fine. Okay, so why do I need my treatment? Remember, there seem to be basic questions here, but so often we get into our doctor's office and we get everything and we forget. So, or we don't know. So write it down, please. Bring somebody else with you. It's important. Remember that the more you are well organized in asking the question, the better it is. Great leaders like you ask great questions. That's across the board, not just CRPS world. Questions are what get things answered. So, and a bad question is a question that's not asked, or is derogatory, or whatever you name it. But a question that is related to your symptoms, to your problem, and it may look stupid to you or to somebody else, is still a good question. Okay, so again, let's go into what's your doctor thinking. The doctor is talking to you and says, he's thinking, okay, what do I do for reactivation? What do I do for the patient's emotional and psychological needs? What medications do I use? Are there any injections that I can do to reduce the pain? Are there any surgical procedures? And spinal cord stimulators. This lecture is not about treatments, but spinal cord stimulator, neurostimulation has proven itself to be, for most people, not all, again, not all, proven itself to be an amazing treatment. It can not work on everybody, but don't be shy in treating them, in using these different modalities depending on what is offered to you. And if a modality is not offered to you, you certainly can ask about it and for it. Again, all this, some of these treatments have side effects, like the medications, injections, or neurostim. You may have a neurostim, you may have, and after a while, it would be more of a curse than blessing. May have to be taken out. But don't be shy in trying different ones, as long as it comes from a trusted doctor that you trust and you want to do it. Okay, just speeding up a little bit, just for interest of time. We are into the doctor's mind again. So what's the doctor thinking? There's examining you. Skin hypersensitivity is critical. Skin color changes, coldness, hot areas, etc. Remember, CRPS is a central nervous system disease. It is not your leg anymore or your arm anymore. We now well know that the entire pathway from where you experience the pain on the hand into the spinal cord and into your limbic system and into your cerebral cortex, into the entire brain, all of that is affected. That's why it becomes a very difficult thing to treat, and that's why it requires so much. But you know what? People do get better. So you talk about the negative, you have to talk about positive. You definitely can get better. Just talking very briefly about some of the things, again, that the doctor is thinking. You need to exercise. The exercise is good for the body in general and good for the affected limb. Again, how is critical. It is true most of the time, much of the time, that if you have an affected limb and you absolutely refuse, unless the nerves are cut to that area for some reason, or there is a reason why there is no more motor activity, you don't use it, you lose it. So critical to do what you can, different types of exercises. I'm going to tell you something else. Whether it's occupational therapy or physical therapy, you gotta be with the right person, because a physical therapist who only treats sports injuries and they don't have any experience, and they don't want to know about CRPS, they can overwork you and make things worse. You need somebody who knows this type of problem, so that when you go see them, they don't overwhelm your system, and it's not your fault when your system gets overwhelmed or you get a mini trauma, etc. And I'll tell you one more thing. I promise you, no, I don't promise you, I hope not, but it will happen. all of us with CRPS, you will have setbacks. You'll have some sort of treatment that will make you worse. Is that good? Not on the surface, no, but it's part of the plan. It can be because it is what it is, and because you learn from it, it can be positive. Okay, a person's emotional and physical distress must be addressed. Your emotions, how you feel, how things are. CRPS is a relationship wrecker. A lot of us have experience with that, but we need to know some of it is through no fault of either or one, etc. So all these things must be addressed, otherwise it becomes very difficult to treat. And the thing about CRPS is, you can take away the pain even by some sort of a catheter or injection, etc. But if you don't take away the stiffness and the muscle atrophy and the emotional parts, etc., guess what? You've only treated one part. Good for you. What about the rest? This is not a complete treatment. Psychotherapy is critical. Psychotherapy could be anything from cognitive behavioral therapy to other types of mind therapy, biofeedback, etc. Different psychologists have different types of tools in their bags, and it depends on what you actually feel, what you feel comfortable with, etc. Ask your doctor about it. And if you are sent to a person who you don't get along with, or is not helping you with your psychotherapy, but cognitive behavioral therapy, it's okay to change. It's not the end of the world. You're not a bad person, and they probably are not a bad doctor. Remember, CRPS should not be a disaster, critical. That's why we're all here. And things like CRPS forum, thank you again. Roxanne, where's Roxanne? There you are. This beautiful number of people here. And believe me, you give her a lot of courage. I mean, I don't know about her personal details. I'm not saying that on a personal level, but you give her as much as she gives you. So it is a teamwork. So be part of it. It's much better to be part of a group of positive thinkers who want to get something done, who want to be involved, than either feeling sorry all the time or being completely isolated all the time, or just getting it from family members or friends as what the heck is the matter with you. Last but not least, we discuss this a little bit further, the winning attitude. Don't get discouraged. There is a lot of hope, especially today. There is tremendous amount going on. Talk to your doctor. Don't feel bad about having more than one, seeing more doctors if one doesn't work out. Second opinion, as long as it's done respectfully, positively. But when you are with one doctor, I recommend, too many cooks spoil the broth. Stay with that treatment plan and discuss it. You can argue with the doctor. Say, look, I've had this doc, and he or she may convince you to do it or not do it, but at the end of the day, what's important is the winning attitude that you have, and you want to get better, and you want to get things done, and then it'll not only make you better, you'll be able to help other people better. Thank you very much.